Alright guys, and welcome to Zesmeralds Gaming, and today we're going to be doing a C-section. Let's get right in. Oh, I don't think this is going to be yummy at all. Oh well, let's see.
Welcome to Surgery Squad's virtual cesarean section. I'm Dr. Jeff.
Hi,
and
Jeff.
I'll be guiding you through this surgery today.
Yay!
A cesarean section, commonly referred to as a C-section, is an inpatient procedure where a surgeon makes incisions in a woman's abdomen and uterus to deliver a baby.
We know.
This procedure is often performed when a physician determines it to be a safer delivery option for the mother, baby, or both. As with any surgery, the use of alcohol and tobacco increases the time it takes to recover, and if the mother has used alcohol or tobacco products during her pregnancy, it can also cause serious birth defects. Our patient today is in her early 30s and is relatively healthy, with exception of a brief history of high blood pressure.
And an ugly-ass
for
face.
us, we get the opportunity to deliver her first baby.
Oh, Jai.
Now that we've covered the basics, let's scrub in.
Yay!
We'll begin the procedure by inserting an IV into our patient's hand so that we can provide her with any medication and fluids she may need.
Oh, she's married.
I've already tied a tourniquet on the patient's upper arm.
I don't like needles.
Can you find a suitable vein in the patient's hand?
No.
Looks good to me.
This big, gross,
Next,
nasty one?
we need to sterilize the insertion area using
What?
an alcohol
They never
wipe.
did that to me. What? Okay.
Now that the area is disinfected, it's time
I
to
don't
insert
wanna
the
do
needle
this.
and advance the angiocatheter into the vein. Take a stab at it.
No, take a stab at it. Oh. Ugh.
The small burst of blood that you just saw in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the vein. Now, I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may pour out of the angiocatheter while the needle is removed. Once you remove the needle, I'll properly dispose of it in a sharps container. I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. And finally, we need to secure the IV with tape and test the IV line. Excellent job. Was it easier than you thought it would be?
No, not at all. It was
In
gross.
order to reduce the amount of discomfort our patient may have, we'll be giving her a spinal anesthesia. This differs from an epidural in that we'll be injecting the anesthetic directly into the spinal fluid that surrounds the spinal cord, and there's no catheter involved. First, clean the area using iodine-based antiseptic solution.
No, I don't want to. Okay. Just clean that back. Clean. Whew.
Next, we'll inject a local anesthetic to decrease
Gross.
the pain the patient will feel when we inject the spinal anesthetic.
Okay, maybe this one won't be... Oh, you use the same needle, just all at once.
So far, so good. Now we need to inject the spinal anesthetic directly into the patient's spine. Now just place a bandage over the injection site and we'll move on.
Okay, that wasn't so bad.
Great.
Tiny little bandage.
Before we can make any incisions, we need to clean the patient's abdomen with an antimicrobial iodine solution.
Okay. God, it's nasty looking. This looks like a 30-year-old man's butt. Ugh. Nope. Don't want it.
Now use the scalpel to make the abdominal incisions. As the incisions are made, you'll need to separate the layers of tissue, fat, and muscle. Are you ready?
No, not really.
It's getting a little messy in there.
Yeah.
Use the suction to clear out some of the excess blood and fluid.
Oh, it's a gross sound. Like you're sucking from a smoothie.
Insert the retractor to push down the patient's bladder.
What? Okay.
make an
Like a
incision
fucking
into
door.
the patient's uterus so that we can begin the delivery. Be careful though, we don't want to accidentally injure the baby.
No shit, Sherlock. Okay, there we go.
We're almost there. Sometimes a surgeon will need to use forceps to help the baby out, but not in this case. The next step is to apply pressure around the baby's head to assist us in removing the baby from the uterus.
Gross. Okay. Ew! Grody! Okay.
Before we completely remove the baby from the uterus, use the suction bulb to
That's
suction
some
fluids
bullshit
from the
right there.
baby's nose and mouth.
Fuck, do you want his brains out? Shit.
Now, let's have a baby.
Drag his
Help me
fucking
remove the
head.
baby from the uterus.
Oh, it's like a little alien. Ugh. Shut the fuck up, kid. You're gross. Okay.
Excellent, but we're not done yet. Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
Shut the fuck up, kid. Yay!
It's a girl.
So pissed off,
Congratulations.
too.
Our team of nurses will take the baby to be cleaned,
Oh, gross.
weighed, and examined before allowing her mother to hold her. In the meantime, we need to remove the placenta.
Oh, this is gonna be gross. Oh, that was nasty. Yeah!
To finish up, we'll need to close the incision sites. I think we'll go with absorbable sutures instead of surgical staples to reduce discomfort and so that our patient doesn't have to worry about
Thanks.
having them removed. You can take it from here.
Nasty grossness is nasty and gross. Get him to get the muscles. Or fat. Something. Grossness. Whew. Ugh. So this is interesting, I guess, or gross, something. It's been fucking disgusting. So, how long does it take to stitch somebody up? Fuck. Shit. Yeah,
You
dude.
did an amazing job.
Fuck
Now,
yeah.
the recovery process begins. I think you should test your surgical skills in another surgery here on
Maybe later.
surgerysquad.com.
Alright, guys, this has been a C-section. Gross.